Even myself, currently also Masters in Social Work from Central University of Gujarat, and my presentation topic is being the Shadow of Superstition, which is addressing the cultural barriers and mental health stigma in rural India. So, what do we know about superstition? The superstition refers to the beliefs and practices that are not based on logic or scientific evidence. In country like India, many such beliefs are deeply rooted in our culture and our daily life. People in rural India are very connected towards the superstition, which um, provides a gap between the doctors and the medical services nowadays. So this superstition commonly involves the specific unrelated actions or objects can influence luck, fortune, or future outcomes. In India, we also say that if any black cat passes through our path and we are going to do something or we are going to attend an event, it will be negative if it happens. It's all on our beliefs. Now, what is mental health? According to WHO, mental health is defined as a state of well-being in which an individual realizes their own abilities and they can cope up with their normal life stress and can work productively and is able to contribute to their community. Due to some superstition beliefs, many of our Indians, especially in rural India, we can specifically say that women of rural India are affecting their mental health due to some superstition beliefs in their culture, in their norms, or in their traditions also. So, what are these impact of superstition on Indians? Through media, we can connect. It's like media as a reality maker. Like many of the viewers through the television have their impact on mental health. They start believing that what is shown on the television or the images seen on the screen form a foundation of an individual internal belief system. They start believing all those actions which are being shown in the televisions. Second is the psychological consequences they face, some arousal and fear. There are some supernatural content triggers the high psychological stress and lasting anxiety within us. There are some after effects also, which leads to haunting imaginary nightmares or fear of solitude within our ones. Then fourth is the barrier to science. So there are some non-fictional risks. Reality-based paranormal shows are more dangerous as they present superstition as a scientific fact, as which is not having any connection between science or superstition. But yeah, due to some lack of education also, many of the media-driven superstition directly hindered the growth of scientific temperament in the society. Nowadays, we are also very connected towards the social media. As is social media shows us, the reels on the Facebook, Instagram, as well as in the WhatsApp, the messages are shown to us, we are very connected towards it. And we feel that there is something real happening in the superstition life, as well as people uh, don't connect themselves with the doctor more, but they are connected with the traditional healers, such as we say that there are some tantric or babas, which shows that there is a gap between lack of awareness and due to that health are getting worse and worse as they don't go to the doctors, they do go to the babas as they satisfy them culturally, traditionally, and ethically. Then fifth is the demographic vulnerability. There are key factors such as levels vary from the age, geography, and education. Younger, educated minds are generally more resistant, but still susceptible to the media influence. So there is a media responsibility also. Channel often prioritize rating, which are seen as TRPs, over their ethical duty to eliminate social blind beliefs. So, what is the existence of the superstitious belief killings in India? So, according to NCRB report of 2021, six death cases are still existing due to the human sacrifices, and 68 people died due to the witchcraft. These are some data where Chhattisgarh shows that 20 people died due to these activities. In Madhya Pradesh, we had 18, and in Telangana, there were 11. So these are some real life incident. One of the Kathmandu post in Nepal, it shows that due to some traditional healers, people are dying needlessly, and there are many incidents which are like shown that lady or the females are having some birth controls or having surrogacy. So the infant are being killed, and villagers are still seeking the help of the faith healers instead of going to the health officials. As there is some lack of PHCs and health centers in the village still, but faith healers are having more priority for the villagers before going to the doctors. So, what are intervention strategies? I have connected these intervention strategies with the social work perspective. So we can overcome through the mental health stigma and superstition in the rural India. So the first one is that community-based mental health literacy programs. So we can help people understand what the mental health really is, and when the awareness will increase, the blind beliefs will decrease. Now there are some collaborative care models with the inclusion of traditional health practitioners that they will show the gap. What is the difference between the faith healers and the doctors? What they give. So, working together with the traditional healers and the some medical professional, guiding the patient towards the treatment will help to overcome the stigma. Third one is stigma reduction campaigns using local media and storytelling. We say that we are usually connected towards something. We usually grab the information instead of reading it. So when people will hear the real life stories in their own language, they will relate more and start changing their mindset towards the superstition beliefs. Then the fourth is accessible integrated mental health services. So at the macro level, we can do that to ensure that people care is available and affordable in rural India or rural places of India. So people don't depend on superstition and they will get the direct advantage of the doctors. Another is the peer support and the family psychoeducation groups. So individuals and family will understand the mental illness and provide emotional support to each other. We say that youth is the future of India, or we can say that nowadays is to children. If we give them the information that okay, there is the difference between the superstitious belief and the actual logical things happen in our life, so they will uniformly present their future and make them family also understand that these superstition beliefs are not, it's just a myth. So the sixth one is economic empowerment and livelihood support. So indirectly improve, it will improve the mental health when people are financially stable and their stress reduces as they rely less on the superstitious practice. So as the economic interventions will also help, which will also, so that it is a indirect intervention, getting some livelihood support will divert their motive or will divert their ideas from the superstition beliefs and will take them to the path of doing something productive in their life. So these are some interventions or social work interventions I would like to mention that will overcome the mental health stigma and superstition beliefs in India.